Welcome everyone to Level 1 MR training. I'm Perry Ratto and I'm the Research Associate for the CARE program. Let's get started. I'll just share my screen here and we'll get right into it. Okay, so this is what our MR room looks like. It's the 3T MR magnet from GE at the Alberta Children's Hospital. Today, what we'll be talking about is how to stay safe in the MR environment. We won't get into a lot of the details of the MR physics, and so I'm going to be guided by the major points that are on this ISMRM approved poster in order to ensure that technologists remember to stay safe. And so they use this acronym SMART, S-M-A-R-T, and I'm going to be going through these points as well as some others, but just briefly to give you an overview, I'm going to be talking about screening for MRI and how we evaluate whether or not a patient has been properly screened to ensure they can go into the MR room. And I'll be talking about the risks associated with the main magnetic field, also called B0, and that's M. And we also need to be sure that we're aware of the acoustic safety issues, in other words, audio, and also that they're able to hear us throughout the exam and that we can receive any signals that they give to us that they may be experiencing some issues. Next, there's the R, which stands for RF field, the pulse that we put into the magnetic field environment in order to be able to receive signal back from the patient's body and the issues associated with that. And finally, T, which is what we're doing today as well as in other sessions, the training that is necessary on a regular basis in order to make sure that we're up to date on what are the risks and that we're aware of them at all times when we're in the MR area. Okay. Screening involves a number of things. First, in order to make sure that we don't waste a lot of time with a subject that is not appropriate to be scanned, they should always be pre-screened on the phone prior to booking. However, we can't rely upon this. The pre-screening is usually done by level 1 that is not as trained as a technologist or other operator of the MR system. So it must be repeated on the day of the scan, and we must have a signed form from the participant. We have to be sure to give the participant 10 to 15 minutes to read and complete the form. This is really important because it's the natural tendency of participants to rush through any forms that they're given and not to read through them carefully. And so we want to ensure that we've had them read it carefully. And in the case of children, oftentimes it's the guardian or parent that is doing this, and they may be feeling some time pressure from their job, etc., which would make them less likely to read it and think about it carefully. Another reason that we want to go over it carefully is that we have to realize that there is some medical terminology on the screening form, and some people will be inclined to skip over it instead of asking questions about things they don't understand. And so we have to elicit responses as well as just simply handing them a form. Now, we should also remember that in the case of a children's hospital, it's often the case that a guardian or a parent will be going into the MR room with the child. And this is different from a lot of other MR centers where only the participant will go into the room. This means that they have to be screened as well. And the screening may be slightly different, but we still ask them to complete the same form and to ensure that they're safe to go in there as well. Likewise, we have to be certain that other people, whether it's medical personnel or experimental personnel, such as researchers that are maybe helping with exam setup, are also screened. And that's why, for example, we need to have every level 1 that is trained, who is expected to be working in the MR area, to also complete the screening form. The forms for level 1s and level 2 people are kept on file, so they don't need to be completed every single time. We expect that trained personnel will remember what are the important points on that form and to update it if necessary. For example, if they've had a surgery which might implant technology or metal in their body, or any other events in their life, such as an accident which might impact it. Now, if there are any surgeries or other items that are flagged on this form that you know are possibly going to be an issue, then you should consult with a technologist or an operator who should be able to answer your questions depending on their level of training. But we must have a signed screening form to begin a scan. And if you're unable to verify the safety to scan, please do not allow this person in the scan suite, and definitely do not allow them to be scanned. In other words, if your bottom line is that you're uncertain whether or not they've passed the screening form and can safely be scanned, then you would always have to turn them away. It is not sufficient to say you're 80% confident. You should be 100% confident, or else you should be seeking advice from someone who is confident based on their training and experience. Finally, just an administrative note, we keep the screening form clipped to a photocopied consent signature page and stored in the completed research studies folder. And that's something that you should learn and memorize when you go down to the MR area in our demonstration, because this is required of every study, that this information is filed in order for us to keep track of the studies and ensure that they've completed the procedures properly. Okay, so what does the screening form look like? The screening form is not something that we come up with. This is something that has been devised and approved by Alberta Health Services, and therefore, though it may not be exactly appropriate for most of our research studies, we still use it because this is the one that they've approved for use within the hospital. And so I'm going to go over this briefly, in the sense that I'm not going to be explaining every medical term that's on here in detail, because for a level 1, you certainly don't need to know that. What you do need to know is enough such that you can pre-screen a participant, and if you're uncertain about something, then seek advice from someone that knows before you book a person in for a research scan. Okay, so let's look at the major sections here of this form. First of all, in order to be able to keep track of who this screening form corresponds to, we required that in the top right corner where it says place label here, that we write down the label that's appropriate for a research scan. In other words, you don't have to have a pre-printed label, but you need to write on it the study name, the patient ID code, not their name, but their ID. In other words, a coded number, combination of letters that is used for that study, and the date and time. And that allows us to track back exactly who that subject was in our database of scheduling. The top section that is listed under patient history is intended mainly for clinical subjects. However, there's a few things that you should know when it comes to research participants who do not typically have medical issues such as they're listing here. So, for example, it's typically not an issue that we have to worry about allergies, because the main concern here is when MR contrast is injected into people. However, keep a lookout for an allergy to something very common like latex or something that might actually they would run into or when they go into the MR area. In terms of patient height and weight, most of the time we are not too concerned about patient height, but we still want it to be filled in. But weight is very critical because the MR scanner is calibrated according to weight in order to make sure that we don't put too much energy into the subject. I'll talk a bit more about that later, but you do need to ensure that, especially for children where a guesstimate is not good enough, we really want them to be weighed on a weigh scale, and that you put in that weight here and mark it as pounds or kilograms. MRI contrast is not really an issue for us, as well as most of these others. However, we should be looking out for someone who has any kind of serious medical issue, and that would probably disqualify them from the study. If they do have ordinary asthma, we should know where the inhaler is, and it should be with them in the console room for the study. And yeah, if they had some sort of significant medical issue, then we would definitely want to follow up with that and talk to a technologist about it. Okay, otherwise, below that, you have two areas where we're asking for a yes or no. It's not very clear on this reproduction, but it is in asking whether or not the patient has, for example, a cardiac pacemaker. And on the left-hand side of this form, you can pretty much say that all of those are red flags. In other words, it's some kind of technology which would either stop working because of the main magnetic field. For example, a cardiac pacemaker would simply stop working. Or else it would be something where we'd be concerned that movement of it, torque or translational movement of the metal object like shrapnel, could potentially cause them harm. Whether it may not be fatal, but we don't want to cause harm regardless in research. And that's our bottom line. So any of those things that were flagged on the left-hand side would be considered a no-go for that subject. The right-hand side would elicit more questions, and it may be possible for them to be scanned, depending on exactly what the situation is. So, for example, there's some common ones here that I want to highlight. IUD is used by many women in order to prevent pregnancy. We aren't concerned about plastic IUDs, Marina being one brand name. However, we are concerned about metal coils that could shift and therefore no longer be effective. And so we would exclude such people unless they at least had a discussion with a technologist first before going in. And generally speaking, I would advise against someone having a copper IUD to go into the MR scanner. Various kinds of pins that are in the body for a purpose such as repairing a knee are acceptable when we're doing a brain scan. However, it should be known that it's MR safe, and I would, generally speaking, ask a technologist about those particular items, but I can tell you that it is very likely that the person would be able to go into the scanner as long as it's below the neck. When it comes to medication patches, we would always want to have them removed, because a patch such as a nicotine patch, which is extremely common, could leave a burn on the person. So if removed, it's fine for that person to go in, but otherwise not. Hearing aids, here you have to be careful because hearing aids are often not easy to see, and people forget about them when they are wearing them all the time. And so we have to be sure that they're removed before the person goes in, not because it's a danger to that person, but because the hearing aids could be destroyed by the magnetic field. When it comes to dental appliances and other kinds of things like braces, generally speaking, ordinary braces are fine. Um, Many people have been scanned with braces to no ill effect, but we do have to be concerned about a large amounts of metal that are beyond the normal braces. In other words, called dental appliances. Partial dentures, like a partial plate, not an issue, but something that looks like a massive amount of metal would almost certainly not be allowed because of the amount of torque that would be on the jaw. Um, and the other issue with respect to braces is that um, they could cause, they will almost certainly cause image artifact in the facial area. So your particular study may need that data of the facial area or be concerned about the loss of image quality. And so it definitely should be brought up with the study lead. Another common question is about tattoos. And so many people have tattoos, and we can certainly scan most of those people. However, my bottom line is that I would not want to scan someone who has a tattoo that's larger than the size of my palm. In other words, you can imagine that's about 6 centimeters wide. And the reason for that is that we can't guarantee that they do not have some kind of metallic ink in a tattoo, regardless of what tattoo parlor has been used, and that ink can then heat up and cause a burn for that person. And since this is research, we have a very low risk tolerance. And although in clinical settings, people are scanned with larger tattoos, usually the technologist will take a lot more care to ensure that there's no issues with that person. So bottom line, if a person has a tattoo that is larger than the size of my palm, I would exclude them. And you can talk to your study lead if you have concerns about that particular one. It would only be probably in exceptional cases that you would want to scan someone like that and then have a technologist as the operator. Jewelry. Lots of people have jewelry. I would always ask them to remove the jewelry if they're being scanned, regardless of where it is on their body. If that's not possible or it's extremely difficult, for example, some people have body piercings, which they normally never take out, then that would be a discussion with a technologist, whether or not that's going to be possible. But generally speaking, I would say no unless prior arrangement had been made with a technologist to ensure that it was safe. For example, if you have a permanent body piercing that's on the lower part of your body that is not going to be in the bore, then there's probably very little risk, but I wouldn't be doing that, making that decision lightly. Okay, so finally, the last couple questions here that you can see are related to pregnancy, and really what we want to ensure is that no one who believes that they are pregnant or has cause to believe that it could be the case are scanned. Because even though pregnant women have been scanned for clinical reasons, we would rather not take any additional risk. And that's our policy. So for men, we simply want to have it X'd out so that we know that these questions have been considered. We can't tell the gender by just looking at this form, so we want to know that this has been properly answered. In the case of women, we don't need to know the exact date of the last menstrual period. We want women to say whether or not they have any reason to believe that they might be late. And so it is sufficient to simply have it written in recent. Okay, Now, the next section is all about surgical procedures or operations which are not covered by the above. And that's basically so that it's a catch-all for anything that people don't recognize on this form that might be relevant. So you get a lot of common things like they've had a broken bone and it's been set, etc. And generally speaking, if you're knowledgeable, then you already know that which ones might be relevant. But if you're not, this is a good time to catch anything that you may not know the answer to and bring it up with a qualified technologist or operator. Okay, finally the signatures. Bottom of the signature page, we want to see the signature of the responsible consenting adult. So obviously for children, this would be the guardian or parent. And if it is a responsible minor, in other words, one which is considered to be of age, which is discussed in more detail in the care handbook, then they can sign for themselves. The operator is the one that signs at the bottom right of this page. So not the level 1, only a level 2 or technologist can sign for this, depending on who is doing the operation of this MR scanner on that day. And that would complete the screening form. Okay, that's a lot of information. I think I'll just leave it at this point, and in the next section, I'll begin talking about gowning and continue on there. Thank you.